At first, you might think it's just a small ache, maybe from your underwear or from your soap or even from the toilet. But days later, the burning sensation gets even worse. Sitting becomes uncomfortable and intimacy becomes painful. And then you start to worry something might seriously be wrong. If this sounds familiar, please don't ignore it. Today, we're breaking down what vaginal itching, burning sensation, and irritation could really mean and when it's time to take action. So if you've ever had a vaginal infection or currently have vaginal discomfort, that itching and soreness that just won't go away, this video will help you to find relief, know the causes and the treatments, both naturally and medically. Hello everyone and welcome back to Good Life Medics on YouTube, where we discuss everything fertility education and women's wellness. Please click on the like this video, click on the subscribe button, turn on the notification bell so that you don't get to miss out on any of our weekly uploads. Let's just get started. Let me tell you about a woman I met recently. For weeks, she has been using so many antifungal medications and creams, thinking it was another yeast infection. She even had to change her soap and switch to cotton underwears. At least she tried. She knows some of the things she's supposed to do, but still there was no relief. Not until we tested her and found out what the problem really was. It turned out she has been treating the wrong infection. So, what are the causes of vaginal itching and burning? I have 4 causes outlined here for you. I'm going to be starting from the simpler ones, the ones that we might be very familiar with, to even the more serious causes of vaginal infection. Number 1 is yeast infection. Yeast infection happens when there's an overgrowth of candida in the vagina. Today, I'm going to be presenting with a few real life examples of what we see every day during the course of work. So there's this lady, she has just finished a round of antibiotics after a mild tooth infection. And a week later, she started having this intense itching, thick whitish discharge, and so many other discomforts. She said she tried drinking more water and even cut down on sugar. Bravo, she really tried. At least she knows that yeast loves sugar. She had to cut down on sugar to know what the problem really was. But the problem here was the antibiotics she previously took. Long use of antibiotics don't just kill off the bad bacteria. Sometimes they tend to wipe out even the good bacteria that help to keep yeast level in check. So after laboratory investigations, we found out it was yeast infection. Some of the symptoms include burning sensation, itching, thick white cyst cream discharge that looks like cottage cheese in appearance, and sometimes no strong odor. Some of the other causes of yeast infection include douching, use of scented products, and some other causes. I have a detailed video about on recurrent vaginal yeast infection, the do's and the don'ts to prevention, the remedies. In this channel, I'll be including the link in the description box. So if it interests you, you might go and check out in full details. So she was placed on a short antifungal treatment plan, cleared it all up, and probiotics to help rebalance her vaginal flora. Now she says that she cuts down on her sugar intake and takes appropriate gut support foods anytime she completes her antibiotic treatment. Knowledge is truly power. If you're finding this video helpful, please type in the comment section, knowledge is power. I mean, with the right knowledge, you will truly go places. So the second cause of vaginal infection is bacterial vaginosis, BV for short. That fishy smell that just won't go away. Bacterial vaginosis happens when there is an imbalance in the bacteria that is found in the vagina, causing a reduction in the number of the beneficial lactobacillus bacteria that lives in the vagina. This could cause symptoms such as abnormal vaginal discharge, which is usually grayish, intense vagina, moderate, or let's just call it moderate to severe vaginal itching, foul smell, fishy, smelly vagina, especially after sex or during menstruation. Bacterial vaginosis is not an STI, but the risk of having bacterial vaginosis is increased once you are sexually active. So there's this patient of mine, she walked in clearly uncomfortable. In her words, she has tried everything, including washing the vagina, use of perfumed products, perfumed sprays, and yet even changing her underwears, and yet the smell just won't go away. She described this strong odor that smells just like fish and this light discharge that is a little bit grayish in color. The truth is, she had bacterial vaginosis, not necessarily because of poor hygiene, but because of an imbalance in the bacterial flora that is present in her vagina. It is not an infection from the outside, it is an infection from within that has caused an imbalance in the natural vaginal pH. So afterwards prescribed a short treatment antibiotic plan for her and encouraged her to stop washing the vagina and instead use plain water alone to wash the vulva, or at most use a mild, colorless, unscented and unfragrant soap to wash the vulva, something that wouldn't cause you more irritation down there. And she was happy at how quickly the infection resolved within few days to a little bit less than 1 week. She was actually happy that it wasn't a sexually transmitted infection or a more serious condition. Please, are you following me so far? Please like this video and subscribe so that YouTube will know we are truly giving value here. Thank you. So what is the number 3 cause of vaginal infection, itching, irritation, and burning? Number 3 cause for today is sexually transmitted infections, STI for short. Are you feeling itchy and burning sensation accompanied with yellowish to green discharge? Don't start taking some antifungal medication thinking it's another yeast infection. It could make your symptoms even worse. That burning sensation while urinating is not ordinary. A high vaginal swab test could help to dictate and find out the root cause of this infection, and you will be fine again. The sexually transmitted infection that usually give off this yellowish to greenish vaginal discharge is usually gonorrhea, chlamydia, and a few others. This can be treated with the appropriate antibiotics and you'll be fine. And anytime you're treating an infection, endeavor to treat alongside with your partner or past partners in the last 4 weeks so as to avoid a reinfection. The fourth cause for today is allergic reactions and irritants. Let me tell you about a lady that once came to me, a woman in her late 20s. She came in complaining of this intense itching and this tingling down there. She was very convinced it was another infection. She said it might just be another yeast infection, but something was just not adding up. She had no discharge, she had no odor, and everything else just seemed fine. So we now started going through her routine, and it turned out that she just started using a new product, a new scented lavender wash, feminine wash that promises to tighten the vagina. And guess what? That was it. Her skin down there was reacting to the fragrance and harsh chemicals contained in the wash. And we advised her to stop all of that. No special soaps, no special cares, just wash with warm water. No soap is even necessary. And of course, we still took samples of her high vaginal swab in case. And after 24 hours of incubation, there was no growth, indicating that there was nothing more to it. No drugs, no anything, just eliminating the irritant, and she was good. Trust me, she was truly happy of how the whole outcome came up. This is actually common, and so many women don't know about this just yet. The skin down there is very delicate and very absorbent, and anything synthetic, harsh, or something could easily initiate a reaction, and that is not what we want. So how do you know that this is no longer normal? Sometimes it is common to feel mild irritation now and then, but if this irritation lasts more than 2 days, is interfering with your comfort, is accompanied with discharge or pain of any sort, then this is not something you need to ignore. Your body is probably trying to get your attention. So what do you do to help yourself out? Here are a couple of things you can do first instead of reaching out to random cream. Number one is stop the use of scented products. Use mild soaps instead, or to be on the safer side, just use plain warm water alone to wash the vulva. I already said the vagina is a no-no for washing because it is self-cleansing. Secondly, wear cotton underwears. They are actually breathable instead of using nylon underwears that tend to trap in moisture and retain moisture, making the place a breathable area for microorganisms. Thirdly, by every means possible, avoid douching. Do not attempt to put your hand inside there or to squeeze in liquid inside there to wash the vagina for any reason. I've said this severally. It is self-cleansing. It is delicate. It does not need you to cleansing itself. The best way to keep your vaginal area clean is actually to leave it alone to cleansing itself. Just wash the vulva with plain warm water alone, and that's enough. Also, ask your doctor if you can use probiotics, especially after taking antibiotic treatment, so that it can help to rebalance the vaginal flora. But endeavor to ask your doctor first. I do not advise the use of unprescribed treatment plans. It is always best to carry your doctor along anytime you have any medical concern. My videos are for educational purposes only and do not in any form or shape replace your doctor's medical advice anytime you have any medical concern. Also, I heard about some soothing kind of gel, aloe or calendula. I haven't made so much research on that, but I saw that somewhere and I thought I was going to mention it to you, my lady. So you can make more research on that and you can tell me what you found out in the comment section anytime you complete your findings. All right, so another is alcoholic wipes. They are not good, they can cause irritation. Stand there. So when do you need to see your doctor? If symptoms persist, then please do not self-medicate and do not self-diagnose. You deserve proper examination by your doctor. Okay, treatment prevents complications and gives you peace of mind. In the case of sexually transmitted infections, if you leave them untreated, most times they can result into pelvic inflammatory diseases, which the resultant effect is usually infertility. You see, and you don't want that. To conclude, a whole lot of women suffer in silence, but there is no shame in talking about your health. You too deserve comfort and clear answers. If this video has helped you, please give it a thumbs up, give it a like, click to subscribe and join this family. We make videos weekly that can be very beneficial to you. Share this video so that you can help a woman who needs this, and I'll see you in my next video. Thank you so much for watching.